Pediatric Orthopedic Surgeon Dr. Vokes often treats knee injuries in kids.
Unfortunately, one of them is when the kneecap is unstable or the kneecap pops out of place.
That's called patellar instability.
The kneecap typically will dislocate to the outside part of the knee, and then typically as the knee is straightened back out, it'll pop itself back into the appropriate position. Typically, if it's the first time the kneecap's ever dislocated, we can treat that without surgery, and that typically involves a brace as well as physical therapy.
For those who do need surgery, it can be done in a minimally invasive manner.
Surgery to stabilize your kneecap can involve a whole bunch of different procedures, and so it's really up to your surgeon to figure out which procedures are relevant to you and your risk factors to why your kneecap dislocated. It's done as an outpatient surgery for the most part, and then there is a lot of physical therapy involved afterwards to restore your knee motion and strength in order to get back to your sport and activity. There's over a 90% success rate in the setting of patellar instability surgery, so those that do end up needing surgery typically do very well.
You can learn more by searching for Pediatric Orthopedics on lehealth.org. For Lee Health, I'm Devin Turk.